Talking about the conventional samples that we take, that is the blood, the urine, the CSF, the bile, the vomitus, all of these fluids are sent to the chemical pathologist. Now, some unconventional samples are also taken in a lot of cases. Some of the volatile samples, that is basically a lot of preservatives have to be added along with these volatile samples because their preservation is very important and they're not easily preserved. So these are also sent to the chemical pathologist for further examinings. And then the body tissues. Of course, the body tissues which are sent to the chemical pathologist in different cases, that is the brain, the liver, the kidneys, all of these are sent, and on request, the suspicions are also noted by the investigator that we are suspecting this kind of poison, and on request, basically, he deals with these kind of poisons. So the volatile substances, when we talk about the volatile substances, what kind of substances we are talking about, we're going to discuss that in detail over here in this section. The body tissue sampling, the brain, the liver, the kidneys, the stomach, the intestines, they are sent to the chemical pathologist and their detailed examination is required in a lot of cases of poisons. For example, the narcotic poisons, whenever we are suspecting them, we are going to send the brain for its analysis. And then the injected substances. If the poison was injected in some of the cases, how are we going to detect it? What kind of samples we are going to take and how are we going to investigate such a case? They're also discussed over here in this fourth and the final section. So the lung analysis for the volatile substances, basically the lung is mobilized and what happens over here is the main bronchus is tied off tightly with a string ligature. So we're talking about the gases. For example, the carbon monoxide poisoning can be dealt in such a way that the lung is mobilized and we are going to basically detect the levels of the carbon monoxide in the lung. So this is the way we are going to do it. The hilum is then divided and the lung is placed immediately into the glass container. This is the whole procedure that is going to be followed, and then the samples, the hilar samples as well as the lung tissue is to be sent to the chemical pathologist along with some of the details of the incidents that took place. So then the hilum is basically sealed off with a Teflon cap, and it is basically just to preserve the way for the air or the carbon monoxide to escape. Not letting it escape is basically the way we can detect it. So the body tissues talking about, it's basically the liver. So how is it sent? It's basically either the whole organ is sent to the chemical pathologist or the aliquot of 50 to 100 grams. So this is the minimum that has to be sent to the chemical pathologist for the examination. Then if we are going to send the brain and the kidney, we are going to send a 50 to 100 grams aliquot. It's sufficient to examine the brain and the kidney. This is how much we are going to send it. Basically, there are separate jars for this liver, brain and kidney. We are going to label these jars accordingly, just for the sake that the chemical pathologist should know what type of tissue is in the jar. And the total original weight. So if we are going to eviscerate an organ, we are just going to wait first of all, and then we are going to cut a small portion, an aliquot of the portion, the minimum that is required, and send to the chemical pathologist. The tissues are excised and submitted to the laboratory. The identifying site from the needle is puncture mark is again going to identify that this was punctured due to the evisceration of so-and-so organ. The zone of the skin and the tissues removed circumferentially around and ellipse cut away. So it's basically the whole circumferential cut that is going to be performed whenever we are going to send the body tissues. A few centimeters in diameter are basically sufficient when we are dealing with such tissues. The depth of sampling is again very important. For the liver, it's basically, if we are suspecting iron and copper, the dry weight is around 77 to 40. And the CSU reference range is around 400 to 1200 ppm. So heart is basically, when it is tested for iron, and the dry weight is around 859 and the CSU values are 202. And when we're talking about the kidneys, it's again the iron, and the dry weight is 3260 and the CSU range is 1010. So these ranges have to be calculated, and they are basically for a reference range, just to see any abnormality in the dry weight and the CSU values. Now the body tissues. The radiography assists in the rare cases. A control area from the remote part of the body sent to the laboratory, and from symmetrical zone or the contralateral side, a radiography is being carried out and just seen over here. So the suspected poisoning, if it is a case of ethylene glycol, then the sample collection is from serum, urine and kidneys, and the sample collection is fresh plus formalin fixed. Now, if we are suspecting, for example, cases of herbicides, it can be treated weeds, urine, ingesta, liver or the kidney that are sent as the sample collection. Talking about lead, kidney, whole blood, liver and urine are sent as sample collections. And if you're talking about mercury, it can be kidney, whole blood, liver, feed. Sample collection can again be heparinized blood. So heparin is basically put just as an anticoagulant to preserve the coagulation of the blood. Then mycotoxins, if suspected, grain, forges, liver and kidney are sent, and specific tests are done for these mycotoxins over here. Now the injected substances, if you're talking about them, then insulin. If you're talking about insulin, it can be morphine are some of the substances which can be injected in the blood, heroin, cocaine, all of these drug abuse related substances can be discussed over here whenever we are talking about the injected substances. Now, what kind of toxicities can be seen in such a person who has basically caused his or her death due to this drug abuse? It can be neurotoxicity. For example, it can basically manifest as Parkinson's disease. So the Parkinson's disease is a manifestation of the neurotoxicity and is usually morphine, cocaine or drug abuse related. And then cardiotoxicity, which can be alcoholic, for example, alcoholic cardiomyopathy. It is one of the reasons for this cardiotoxicity. Then talking about the pneumotoxicity, it can be the paraquat-induced lung edema, which can cause this pneumotoxicity over here. Now, talking about the hepatotoxicity or the toxicity of the liver, it can be induced, for example, by the paracetamol overdosage. So this can be one of the causes of the hepatotoxicity. The nephrotoxicity, that is the toxicity of the kidneys, is cadmium-induced proximal tubular nephritis and is one of the causes of the kidney toxicity. Dermatotoxicity can be related to the arsenic, and it can be related to the keratosis. So all of these are basically the different types of toxicities manifested in different types of cases. So in this section, basically, we dealt with the volatile substances. What are these volatile substances? How can they be diagnosed in different types of cases? And then the injected substances and how can they be diagnosed in different types of cases? And what are the samples that can be taken in such a case? That is the end to this section. Thank you for watching sqadia.com.